So the next group of muscles we'll be demonstrating pen and stretch for are the internal and external rotators of the hip. So we'll be doing the piriformis, which runs in this direction and does lateral rotation, and the glute medius, which is fan-shaped and runs in this direction, and it does medial rotation of the hip. The piriformis does lateral rotation, so to lengthen it we'll be doing medial rotation. So again, you're going to start at one attachment site and then slowly bring the leg rotating . Then we can transition right to glute medius. The next group of muscles that we'll be working with to do pen and stretch are the hamstrings. Now, because these are a broad muscle across the back of the thigh, we're going to be using a broader point of contact, so soft knuckle, and we'll be moving across the muscle this way as we go. So you'll bring the knee into flexion to shorten the muscle, apply your pressure, lengthen, move across, same action, and then we move in a distal direction. Again, an area that you want to be concerned with is the popliteal region, so you would not apply pressure directly to the middle of the back of the knee, as that would probably be uncomfortable for your client. Next group of muscles we'll be working with will be the gastrocnemius and the soleus. So this works better if you bring the knee into a flexed position. So because these muscles do plantar flexion, in order to shorten them, we're going to be plantar flexing the ankle. Then you'll be applying your pressure and dorsiflexing the ankle. Now I'll do the medial head of the gastrocnemius. The next group of muscles that we'll be working with are the quadriceps. So in order to do this, it's important to have the client towards the edge so that you can bring their knee off. These muscles are responsible for knee extension, bringing the legs straight. So in order to stretch them, we'll bring them into extension, place our hand, pressure down, tension on the muscle, and flex the knee. Then reposition. Because this is a broad muscle, then I'll have to move and do the anterior fibers as well. The next group of muscles will be the muscles that make up the anterior compartment. So these muscles are responsible for dorsiflexion of the foot. So we'll bring the foot into dorsiflexion, apply pressure, and plantar flex. These muscles may be particularly tight, so it's important not to try to force it. As long as you're feeling a stretch, you're getting enough movement in the joint.